Okay, so don't forget about race. That's the sequence. Always follow that. That's very important. And also remember the acronym PASS. That's for the use of the fire extinguisher. That's pull, aim, squeeze, and sweep, right? And it's you're aiming at the bottom of the fire. Okay. Now, very important to know. Here's a few things because this is sometimes what they'll ask you as a prioritization for your patient. You prioritize patients that are closer to you. You rescue them first, and the ones that can actually move around. The ones that can walk, they're the ones who you rescue first. The ones that are non-ambulatory, meaning bedbound or further from you, that's the one you rescue last. Okay, because why? Your priority is to save as much people if the disaster is inside the building. Now, if the disaster is outside the building, then all you need to do is don't go outside. Make sure you seal the entire building. That's very important. Okay? Alright, so but if it's inside, rescue the ones that can move first, the ones that's closest to you, and then rescue the ones that are further and non-ambulatory last. Now, what can you delegate to the UAP? The UAP can actually get the fire extinguishers. That's one thing that you can delegate, and close the fire doors. Okay? Now, you don't want UAPs to be giving instruction because as a UAP, based on an exam, we all remember, right? We have to base it on the book. They're not supposed to be coaching. They're not supposed to be giving instructions. The ones that should be doing that are who? The licensed nurses. Okay? Alright. Very good. So, other than that, if you have a patient that's on fire, the instruction is stop, drop, and roll. That's very important, okay? Anyone who's on fire, stop, drop, and roll. And we prioritize, of course, airway, breathing, circulation. Now, if our patient is an electrical fire, victim, you need to make sure turn off the electricity first. So if there's a question that comes out, the immediate action of the nurse is to turn off the electricity before doing your assessment on the victim. Okay? Now, here's an important thing though, and we're gonna add this because this is actually part of a patient that experienced electrical burn. Some patients that experience electrical burn, they can go into cardiac arrest. So what does that mean? We need to assess them for the possibility of CPR, right? So what do? If it's an adult, we check first the carotid pulse, and then we check the rise and fall of the chest. If the victim is less than 3 years old, we use the what? The brachial pulse, and then we check the rise and fall of the chest. Okay? Now if we have a pulse, we have rise and fall of the chest, right? Adult right here, carotid, we don't need to perform CPR. If we don't, then we need to immediately what? Perform CPR. That's needed. Because again, for someone who had an electrical burn, they can go into cardiac arrest. And it's very important that we maintain circulation. Remember, when it comes to CPR, circulation is the #1 priority, not airway. It's CAB, circulation, airway, breathing. That's when it comes to CPR. So we need to make sure we immediately what? Do chest compressions. Okay? Alright, don't forget that for electrical burns. Okay? Now, we did discuss about chemical. We did discuss about it being outside. Now, what if the chemical is inside? What do? Then what should be the immediate action of the nurse? Evacuate the patients that are close to that site. That's the immediate action. Sometimes there will be an option to call like a poison control or emergency services. That should not be the immediate action. The immediate action is the same thing. You move the patient away from the site of the spill. Is that clear, guys? Now, one of the things that they will ask you is, when you call for help, what is the manual or information they're gonna need to clean up the spill? Don't forget that one. MSDS. MSDS, okay? Material Safety Data Sheet. Don't forget that, they asked that. You'll be surprised, even on your boards exam. You know, one more thing that they actually ask, and we'll discuss that later on data safety, especially for exit, is what is an important safety connection for internet? So they ask that too. So believe me, they've been very focused on the nurse knowing their resources. What's a good internet? What's a good website to go to in gathering information? What's something that they should use if there's chemical spills? Okay? So, this one right here, MSDS. Take note. One thing that's very common that has been happening before and can happen still now is mercury. Mercury spill. Take note, mercury spills should not be cleaned like vacuum or wiped. Any mercury spill, the immediate action is move away all of your patient from that, seal that area, and let environmental services handle it. You are not to clean it as a nurse. You are not. You are supposed to call the Poison Control Center to handle mercury spills. Okay? So again, any mercury spill, you're supposed to move away your patient out of that place. Alright? Because it's very poisonous and dangerous. Now, here's another thing that they ask a lot also on your boards exam. Blood spill. That's not a chemical, but that's blood, right? Here's what they ask. What do you use to clean blood spills? Bleach and water. Bleach and water. Okay? So here's the thing. If you don't find 9 parts water, 1 part bleach, the answer is chlorine. That's the same thing. I want to make sure you guys are aware of that. That 9 parts water, 1 part bleach, the name for that is chlorine. Bless you, bless you. Chlorine, okay? That's what they use to clean up blood spills. Alright? Everything else, they'll use, of course, the material safety data sheet to make sure that they know the proper type of chemical to use to clean that chemical spill. Okay, now, here's the other question. This is more specific for the exit, but you might see it also on the NCLEX. If they don't have the material safety data sheet, what is the best website to check to find an answer in cleaning chemical spills? What should be that website? CDC, something that has a what? .gov. Don't forget that. A website that has .gov. Do not pick a website that has .com, edu, that's okay, educational, but the best answer is what? .gov. Okay? And specifically, you're looking for information, take note, peer review. P-E-E-R, peer-reviewed materials. Those are the only type of information on the internet that's reliable, especially when it comes to health information. It has to come from a .gov, and it has to be peer-reviewed. The way you spell peer is P-E-E-R. Okay? Is that clear, guys? Alright, very good. Any questions so far? Alright, so let's take a look. Our next one is, there we go. Incidence of falls. How do we manage and reduce the risk of falls? Okay, let's take a look. The nursing unit is working on a plan to decrease the incidence of falls. What would be a priority action for the nurse? So priority, very similar to the word first, very similar to the word initial. What do you think would be our answer? Take a look at the options. The options that's different from everything else is the right answer. What's the answer? C. Letter C. Very good, right? Priority, first, initial, we're looking for an answer that's what? An assessment. Everything else, look at this. Intervention, intervention, intervention. There's only one answer that's what? An assessment. Okay? Here's another clue that I told you guys in regards to technique when you're answering a question. Do not pick answers that has the word what? All. Every. Right? Why? Because there's exception to the rule. Those options are not good answers to pick. If they have the word always, every time, never, don't pick them. Stay away from those options, okay? Don't forget that. Stay away from those options. Let's take a look. How do we determine risk for falls? The nurse is caring for 4 clients who is at risk for fall. What patient has the highest priority? You are the nurse and you're identifying your patient. Who would be your patient that you need to focus on? Alright, what do you think's our answer, guys? Letter D. Are you guys sure? That's correct. Letter D. So, what's our reason behind letter D being the right answer?
Blood pressure pills.
New blood pressure medication, orthostatic hypotension, right? Very important because they'll ask you that. Patient with new pain medication, new blood pressure medication, anti-anxiety medication, all 3 classes has the effect of orthostatic hypotension. That's why we tell the patient that if they're taking this, especially if it's new, slowly change position from lying down to sitting. And when they're sitting down, dangle their legs first, right? You want to make sure they do that before they slowly get up so that the blood can actually go back to their head and they don't get dizzy and fall. Orthostatic hypotension, right? Okay, very good. So that is the right answer, letter D. Okay, so a fall, and I want you guys to know this, they're going to ask you on exit and on your NCLEX, what are considered incident reports? Is a fall considered an incident report? Yes. Okay, very good. The nurse is caring for a client and upon entering the room found the client on the floor. What will be the immediate action for the nurse to do? How would it be? Letter?
B.
Letter B. Can the UAP do that? Can the UAP do that?
The vital signs. Oh, no.
Because it is an acute condition they felt, right? So, acute, you gotta remember, UAP can do that, right? Alright, so, here's the thing. Can you found someone on the floor, what would be the highest or something that you need to do first? What would you do? Check the patient. So, the answer is letter C. Ask the patient their bed. How are you doing? Are you okay? Because if you put them back on the bed without doing your assessment, you could end up what? Injuring your patient. That's another thing. It didn't have the word first, it didn't have the word initial, but if you actually use your technique, intervention, intervention, intervention. There's only one thing, that's what? Asking the patient. Okay? And always remember, this is the number 1 rule. When it comes to highest priority, if it's not A, B, C, D, guess what? And something happened to your patient, before you do anything for that patient, what do you do first? You check them first. check them first. You're not gonna go wrong on that. If you pick that answer, that you check them first. Because the rule is, you will not be able to take care of that patient the right way unless you're checking that patient first before you do anything. Check that patient first. You know the only exception to the rule, and you will see this on your exit and on your NCLEX, respiratory condition. If you have someone who's short of breath, that's an exemption. Why? Before you actually help that patient or assess that patient, what do you do first if there's an option? Raise the head of bed. That's an exemption to the rule. You don't assess that patient first if they have respiratory issue. You actually what? Raise the head of bed first to help them with breathing first, right? Before you assess them. Here's another exemption that you will see. Patients who are having chest pain. If I'm complaining of chest pain, before you assess me, what is something that you need to tell me first? If there's an option like that, sit down and rest. If you have that on the option, especially on your exit, guys, pick that first, that you're gonna ask the patients to sit down and rest. Why? Because if I'm having a chest pain and you're assessing me like this, what's gonna happen? I'm probably gonna collapse. But if you ask me to sit down first, then that allows my body to rest. And if I'm only having angina, just by sitting down, that chest pain is gonna go away. But if I'm having an MI, then even if the pain continues, I'm not gonna fall because I'm already sitting down. That's another exemption to the rule. Okay? Those are some of the exemptions. But everything else, if you have something happening to the client and you don't see those other exemptions, the best answer to pick is assess them first. Don't do anything. Especially for someone who fell, why? Fracture. That's a big thing. Exit and NCLEX, they have a lot of questions on fractures. If you have someone who actually falls and they have a fracture, you're not even supposed to move them when you're assessing them, right? After assessing them, what are you supposed to do? Keep them in the same place and make sure that you what? You splint, stabilize the fracture. You don't even move them. So that's why it's important that we what? Assess. Okay? Now, for falls, here it is. The best thing in order to prevent the incidence of fall, identify your patient. Who are at risk for falls? Because not everyone is at risk for fall.
Elderly.
And not everyone is going to need intervention. Right? So we identify first who are the ones at risk. Now, anyone though, that let's say for example falls, don't forget it's an incident report. What does that mean? There's a sudden change that needs to be investigated. That is an incident report. That's one of the examples. Okay, if the patient fell, and based on your assessment, they have a fracture, okay, now what tells you though? Number one, because this what they will ask this on musculoskeletal. You have a patient that fell, how do you know if the patient has a fracture? What's the number one manifestation of a fracture? No matter what, even if it's the arm or the legs, that's the number one best signs and symptoms of a fracture. Pain with movement. Okay? Don't forget that. Write that down. Pain with movement. That's the manifestation. And that is one of the main reasons why for anyone who has suspected fracture, we actually stabilize the fracture. Why? Because the more you stabilize it, the less what? The less pain. But the more they move it, if you're not going to stabilize it, they're going to experience a lot of pain and they can go into severe shock if the pain is too much. Okay? So again, pain with movement. So if you see that, you got to make sure that you're not moving in the client, not until what? Help is there. To make sure that we don't fracture that area again or more. Okay? So don't move the client. Make sure that you split it. Okay? The only time that you can actually move the client is based on the environment. If the environment is not safe, then move them. You have to, especially if they're right there in the middle of the street, right? You have to move them for safety purposes. Because that safety is an issue there. But if not, don't move the client until you have help. Now, other signs and symptoms that I want to make sure you guys are aware of. Hematoma. What does that mean? You have bruising on the area of the fracture. The fractured part of the body is also shorter. Okay? Why? Because they actually get displaced, they get pushed. So arms, leg, they get shorter. Okay? If you also see someone who has a leg fracture, because let's say they fell, their leg is usually like this, turned outward. You know, it's actually like this, turned outward, and it's toward the other leg. That's how it is, right? That's why when they have a hip fracture, the treatment is we put them away like that. Make sure we abduct them, right? But for someone who has a fracture, it's gonna be like this. Okay, which is, you know, what's here on this picture right here. Alright, arms or legs, it's gonna be shorter, it's gonna be adducted rather than abducted. Okay, and there's of course the number one thing, pain with movement. Pain with movement. If that's the case, you have someone that fell like that, don't move them, not until help has arrived, because you don't want to cause more injury to the client. Now, how do we prevent this incident from happening? How do we prevent it? Here it is. Don't forget. Here are some of the things that we can do for our client to reduce the incidence of fall. Low bed. Personal belonging at bedside, especially the bedside table. If they need a commode, it's better that they have a commode. Bed alarm or chair alarm, right? To actually tell us if they're trying to get up. Okay, night lights, take note. Do not pick an option that they're using the TV as a night light. Not good. Why? Because it's not actually gonna allow them to sleep properly. Okay? Now, if there is a light by the restroom, that's fine. That's an acceptable night light. But not the TV. Okay, not the TV. Remember, if you want someone to go to sleep, the right thing to do is do not stimulate them. So if you have the TV on, or you ask them to exercise 30 minutes before they sleep, that's gonna keep them awake. Okay? Remember, in order for your patient to go to sleep, less stimulation. That's the key. That's the key. So, night light, TV not acceptable, light in the restroom, acceptable. Okay? Non-skid socks, non-skid shoes, fall precaution bracelets, okay? Call light within reach. Patient, if they're really high risk, they should be near the nurse's station. We remove clutters, and for certain patient that has diuretics or has incontinence, we need to put them in a toileting schedule. What does toileting schedule mean? Throughout the day, we actually take the patient where? To the restroom. Even if they're not asking for it, we take them there, because sometimes elderly patients don't ask. They wait until the last minute that they need to go and it's all full, and then they try to get up and then they fall. So for toileting schedule, that means we're taking them to the restroom on a scheduled time, even if they're not asking for it. And then of course, side rails up. That's very important as part of the prevention of fall. Okay? Alright. Any question on preventing falls? Very good. Next one. They ask this a lot also. This has been coming up even on the NCLEX. Change of shift report. If you are the outgoing nurse and I have an incoming nurse, what is going to be part of my report that I need to tell you as the incoming nurse, and what do you need to ask me as the incoming nurse? That's important. Change of shift report. What are things that we need to see? Let's take a look at this question. A nurse is preparing to give a change of shift report on a group of clients. Which of the following statements should the nurse include as part of the change of shift? do you think is the answer here, guys? Letter C. Okay, so letter C meaning any type of medication that's new. Here's the other one. Any type of medication discontinued. So you gotta remember that. New and discontinued medication, meaning they took that out of the patient's order, has to be in the change of ship report. Okay? Alright. Here's the other thing before we go over some of the details in change of ship. The nurse is providing change of ship report to an oncoming nurse. Which of the following information should the nurse include in the report? This here, what they're asking you is how should the report be given? Or what should be included in that report when you give it? Okay, the answer is letter D. Very good. Dog. Good job, guys. So, very important, whether it's an incident or change of ship report, here's the thing. It has to have what? Detail. Detail that is something that really happened. No speculations, okay? No guess information. It has to be specific. It has to be specific to what happened. So, not specific, poorly. We don't even have to report facts, right? Upset, not specific. What's really going on with the client, right? But this one is specific. You have a new patient, that's part of the change of ship report, and what's happening to that patient. Because you need to follow up as the incoming nurse. So, new patient, here's the other one, discharge patient. Should also be part of the change of ship report. If you have a patient that left because they're no longer there, you have to report that if they were part of your shift when you started. Okay, very good. So very important, don't forget this slide because this tells you, okay, what are the things that should be included. It also should include what? Follow-ups, appointments. Any patient with follow-ups and appointments for that day should be included in the change of shift report. Okay, that's another one. Any question on change of shift? Okay, especially those who have change of condition, that has to be reported, okay? Don't forget this list here. Next one. I'm gonna ask you this before we answer this. They ask this, especially also on board exam. Which department, in regards to healthcare, establishes the rules on medical abbreviation? The answer is Jacob. Don't forget that, okay? Jacob. Okay, I'll give you guys the definition. Jacob. So Jacob is the one that establishes this. One of the things that they always ask also, especially on your exit, is which ones are the acceptable abbreviations. So if we're gonna pick here, which are the ones that we're gonna pick? So let's go over the list, right? Can we pick A as an acceptable abbreviation? The answer is no. Here's why. A is a medication, it's morphine. You cannot abbreviate medication names. You cannot abbreviate procedures, okay? You cannot abbreviate diagnostic tests. They should be written out how they are, like, you know, what exactly what it is. What's the name of that procedure? Okay, so now letter A, we won't pick that. How about B? Is B an acceptable abbreviation? Yes, it's an acceptable abbreviation. How about letter C? Is that acceptable? Yes. How about if I put here STAT? S-T-A-T. Is that an acceptable abbreviation? Yes, because stat means what? Right now, right? Acceptable. Stat, write this down because this one comes out a lot. Whether it's written in small letters or in capital letters, it's acceptable. Stat. Okay, same as with BID. BID, you write it in small letters or big letters, it's acceptable. How about letter C? Is that acceptable? Yes. How about letter D? No, right? Because we said any decimal answer should have a 0 in the front. So not acceptable. How about E? Take note, no more. It's no longer acceptable. It was acceptable before as what? Every day, but now you need to write down daily now. You have to write it down as daily. So no longer acceptable your QD. Okay? That's an update also on your ATI exit. No longer acceptable QD. It has to be daily, or you have to write down every day. So here are the most common mistakes that gets used in regards to abbreviation. So stay away from it. Okay? Stay away from it. And what you're supposed to do if you need to write it down. Okay? Even potassium, if it's going to be given, you have to write it down as what? Potassium. You can't write K. You can't write Mg. You can't write Ca. You can't write Na. It has to be sodium, potassium, magnesium, calcium.
So you can't write P.
Yeah.
P plus now?
No, no more. They're actually all like now, has to be like all like, spelled out. Spelled out, okay? Any question? Alright, very good. So don't forget abbreviations, okay guys? Last week we talked about how to write prescription, right? I forgot one thing there because they asked this also, especially also on board. When you write a prescription, you have to write down read back and verify. You have to write that down, okay? Any type of order that you get, especially coming from a telephone order, you need to make sure that you read it back to the doctor and you verify the order that was given to you. So read back and verify. Okay, RBV. Okay, very important. If there is prescription orders, or let's say for example, patient information, because they use the internet now a lot, very important. What's the best source of internet? What's the name? They ask that a lot. Especially on your exits. It's called VPN. Please write that down. VPN, Virtual Private Network. Okay? That's on informatics safety for NCLEX. They asked that a few weeks ago. That they were asking, what is the best source of internet? Whether you're in, like you're in the airport, or you're in a hotel, you're a nurse, and you want to make sure that you're going to have to transfer some patient information, what type of internet are you going to connect to? VPN. Virtual, personal, or private network. Okay? Don't forget that, guys. Good. Very good. Okay, I have a different slide for incident report, so we'll go there on incident report. Yeah, but here's the information earlier that I wanted to share with you guys. I said that if you're going to use internet resource, what is the best source of information in the internet? Don't forget, it has to be .gov, and it should be peer reviewed. Okay, that's on safety informatics. You're probably wondering, how come all of this crap is coming out now? Well, because we're using a lot of computers now for healthcare. So they want to make sure that you know your safety informatics, okay? All right. We're gonna go back to this because this is actually part of our mental health. We're not gonna do that, okay? Here's what we're gonna discuss. Here's another one. That's part also of your exit and NCLEX. They've been asking now certain things that the nurse should do to maximize saving time. Okay? So they've been asking this like as a nurse, what would you do so that you can save more time in your shift? Why? Because they want to make sure that all of those time that you save, that you're investing it into your patient. Okay? So, this one, not really that hard. You just got to remember though some of the things here that helps you save time and helps you waste time. Okay, so let's say for example, here's an example. You're going to give all of your medication for your patient and then chart at the end of your shift. Is that a time saver or is that a time waster? I'm gonna give all of my medication to my patient and then chart at the end of my shift. Waster or saver? Waster. Why? The rule is each time you give a medication for each patient, you're supposed to what? Document and chart. Right? Here's an example. Right? Here's another example. I will take care of all of my patient first before I move to the next patient. I will take care of all of the needs of my patient first before I move to another patient. Waster or saver? What is it? It's gonna be waster. Why? Why is it a waster? You're supposed to prioritize. If you have a patient that has a priority need at that time, you have to go there. You have to go there. Although you can finish all of the things you need to do in one patient before you move to another one, except for what? When that patient needs something. Because why? As nurses, we need to prioritize. Here's another example. If you have a patient that is harder to take care of, do you take care of that hard patient in the beginning or do you take care of that hard patient last? What's a time saver there? I will take care of my hard patient first. Is that a time saver? Depends, correct? But the answer is it's actually a time waster. Why? Because at the beginning of your shift, when you're taking care of hard patient, you're not going to have anyone to help you because everyone is doing their own what? Their own patient. So we actually prioritize easier patient, get all of the easy patient out, and you've taken care of all of your other patients, and what remains are the what? The harder ones where you can ask each other now help to take care of the harder patient. Is that clear? Take care of easy patient first before you take care of the hard ones. You know, and it's the same rule for isolation precaution patient. Because if we have isolation precaution patient, they're harder ones. Do we actually give a shower to an isolation precaution patient that's harder first before we give a shower to every other patient? We give them shower what? Last. Because they're hard to take care of and they're isolation patient. That's why they go last. Okay? So remember this, make it easier for you. I've seen a little bit like this on NCLEX, but more on the exit. Remember this. Okay? Remember it. Don't forget it. Time saver, time wasters. Okay? Alright. Let's see. Before we go on a break, we are going to go to information safety. A nurse is observing an AP. For which of the following action by the AP the nurse should intervene? What situation do you think that the charge nurse needs to intervene when it comes to privacy and confidentiality?
D.
Letter D, correct. We never tear off, right, papers. We need to make sure we drop it into the red box. There you go. Okay. A nurse in a medical surgical unit is caring for a client who asked to review his medical record. Which of the following responses should the nurse make? Again, based on information safety, privacy and confidentiality. Even if they're the patient asking, what should we actually do? The answer is letter D, correct. Even if they're the patient, they need to request a specific information about themselves. That's very important. Okay? Here's the other thing that I just like to add, especially when it comes to patient like health information or labs. Let's say for example you have a spouse and you have a DPOA asking, which one has the priority when it comes to your patient's health information? Do you give it to the spouse or do you give it to the DPOA? There shouldn't be any what? The information should go to the DPOA. The DPOA has more say, they have more right to the patient's health information rather than the spouse. Even if the DPOA is just the neighbor, but that neighbor represents the patient. They're the patient themselves. They represent the patient. So if you have a spouse asking and you have a DPOA asking, the first one you're gonna give information to is not the spouse, but rather the who? The DPOA. Always remember that because that's legality when it comes to confidentiality, okay? That's what it is. So it's very important that we know that the DPOA is the one that has that. And here's the other thing that I want you guys to remember because also it comes out. No member of the healthcare team that's not taking care of the patient should receive information. Okay? So what does that mean? If they give you an option that you have a nurse caring for the patient and a doctor working on the third floor, which one are you going to give information to about the patient? It is the what? The nurse that's taking care of the patient, not the doctor. Because even if that person is the doctor, that doctor is not working with who? The patient. And they don't have the right to get the information of the patient if you're not directly working with the patient. Take note of that because they will challenge you on that you need to know who is your priority when you're giving patient information. Okay? So again, do not give any patient information if the description says they're not directly caring for the patient. If they are directly caring for the patient, then they're the priority when it comes to patient information. If they're not, they shouldn't even have it. They shouldn't even have it. Okay? Is that clear? Alright, very good. Okay? You gotta remember that. So privacy rules, here it is, okay? Privacy and confidentiality. Before we move on, when it comes to like, let's say, privacy in the patient's room, sometimes this is where I see students make some mistake, especially on their exit. They usually pick the answer of closing the door. Please don't pick that. Okay, the answer should be what? Closing the curtain. Okay? It's same thing with NCLEX. Sometimes we think that, man, well the door is the best one, right? Because you close it, you pretty much have privacy and or confidentiality in there, right? But here's the thing: when you close the door, it's a safety hazard. Because if something happens to you inside the room and with the patient, it's gonna be very hard to ask for help. So always remember, if you ever go into that situation, they're asking you, privacy, and they're asking you what's the best thing to do, curtains. Curtains is the answer, not the door. Okay? Because that's important. And then again, never share your password to anyone, and always make sure that you log off once you're done using the computer. Okay? Alright. Those are very important. Here's another thing, okay, that's on the list when it comes to security protocol. Okay. Alright. Any questions? Any questions? Okay. So we're gonna go on a short break. We'll be back to do incident reports. Come back at 10:45. But 10:50. 15 minutes. Go ahead, guys. We're almost done. 10:50. Bless you.